First aid for spider bites depends on the species of spider and whether the spider is venomous or not. Common venomous spiders that may cause harmful bites include funnel web, mouse spiders and redback spiders. Join us to explore first aid techniques to apply when bitten by a spider, but before that, let's take notice of some symptoms of spider bite. When it comes to the symptoms of spider bite, there are general symptoms and additional symptoms based on the type of spider. General symptoms of spider bites may include sharp pain at bite site, sweating, nausea, vomiting and abdominal pain, burning sensation, swelling and blistering. For funnel web or mouse spider bites, additional symptoms can include lots of saliva and tears, muscle twitching, difficulty breathing, small hairs stand on end, numb mouth, fast pulse and high blood pressure, disorientation and confusion leading to unconsciousness. For redback spider bite, additional symptoms are escalating pain, patchy sweating, small hairs stand on end, headache, muscle weakness or spasms. However, redback spider bites usually do not cause life-threatening reactions. For first aid techniques on spider bite, I group them into two. First is for funnel web and mouse spider bites, and the second is on redback spiders or other spiders. Before I begin, make sure to save this video, as it might be of help to you in the future. When bitten by any spider or by redback spider, please follow these first aid steps. First action is to wash the affected area well with soap and water. After washing, relieve the pain with ice pack for 15 minutes and reapply the ice if the pain continues. Use simple pain relief such as paracetamol, but if symptoms worsen, seek medical help. Note: do not bandage the bite area since pressure will increase the pain. Always remember, first aid should be done as quick as possible. If someone gets bitten by funnel web and mouse spider, the first thing to do is call for assistance or for an ambulance if possible. Then lie the person down, ask them to keep still and reassure them. If the spider bite is on a limb, remove any jewelry on the limb if you are able to do so, and apply a broad pressure bandage or clean cloth over the site. Mark the site where the bite is on the bandage with an X. Apply another elasticized roller bandage starting just above the fingers or toes and move upwards on the bitten limb as far as can be reached. As you go back over the bite site, mark it with an X again so the mark can be seen on the outermost bandage. The bandage needs to be firm but not too tight. In all this, continue to check the color, temperature and feeling in the fingers or toes. Keep the person lying down and completely still. Continue to stay with the person until medical help arrives. But if no medical help is coming, organize a means to transport the person to the immediate health center. Again, always remember, first aid techniques should be done as quick as possible. I hope this tips helps you or your loved ones when bitten by a poisonous or venomous spider.